Thank you for having me here today. Thank you, Kate and Christina. And it's lovely to be here today to talk to you about how to live well with your MND in terms of speech pathology stuff. So hopefully I'll share some insights into staying in control of your speech, your swallow and saliva. I would have to say that this has probably been the toughest brief that I've been given, to give a talk to you really brave, strong, stoic people about how to live well with MND. And so hopefully I've designed a talk that today provides you with some information that you need to live well, to live comfortably with your MND. Many of you here today may have come because you're proactive about your care and you like to know what's going to happen, and it gives you a sense of control, and that's fantastic. Some of you are here maybe because your carers or family members are proactive about your care and they want to know what they can do to help you live comfortably and help them live comfortably as well with your MND. And some of you may have been dragged here because somebody might have thought it might be good for you. But whatever your reason is for coming here today, I do hope that you find the information that you're looking for, but I'm sure that I can provide some hope and light to make the journey before you a little bit easier. So today, we are really going to touch on the following, a recipe for success. That in the darkest of times, and on a day that was ordinary for you, that was turned upside down, there can be a bit of a recipe for success. You just need to be open to it. I'm going to talk about some clinical stuff about what the role of the speech pathologist is, and how we help in terms of your communication, your saliva and your swallowing. I'm also going to talk about some emotional stuff, some tricky conversations that you'll have with the speech pathologist and other members of the team about legacy, about who you are, and about what Dr. Brennan was saying about, and the spiritual kind of side of stuff, about how we know who you are and how you live on with that. And I'm going to finish on some insights from people with MND, because I think there's such power in hearing from people who are going through similar things to you. So the recipe for success, I'm going to just pop this down. I don't usually talk with my notes, but yeah, maybe. So there's a bit of a recipe for success that I've observed clinically from all my patients over time. And the people who kind of seem to be living comfortably or seem to be doing fairly well, both themselves and their families, is where they have come to this innate sense of acceptance about their motor neurone disease. They're a little bit motivated, and they're very motivated, and they've got a bit of an open mind. So they're not closed, they're happy to listen to what the recommendations are and decide what fits for them. Obviously, these philosophical things are all dictated by your personality and your attitudes to life in general. As I said before, an ordinary day for you turned upside down. How can you continue your life as you knew it? Have the actual attitudes or behaviours of your families or others around you changed, and that's impacting upon you? How do you make the use of the time you have left to keep living? And are you ready to ask yourself these hard philosophical questions and have the conversations about what all this means to help you navigate the best way forward, to help you come out of the fog and start to cope? Human emotions are fickle and challenging things. From my clinical observations of people with MND and in my work in palliative care, as well as my own personal experiences with grief and loss, the success, I think, to living well in the face of adversity, such as what you are experiencing in a huge way, is about how willing you are to take control over the things you can. It's about how you seize the opportunities that are available to you and about the choices you make with regards to how you respond to the changes happening to you. It's about how willing you are to accept help. And as with all things in life, it's about balance. How much weight do you put on walking versus talking, for example? How important is safety versus risk to you? And what is the economy of your stress? How important is time? And how will you use it? Will you save your stress to buy more time? And my talk to you really is about the concepts of balance and time. Everything that you will experience with your hub of support or your multidisciplinary team is going to be underpinned by those two very things, time and balance. So we just have to get the balance right. If there's one silver lining, I think, from MND, is that time can also be in your favor. Like Dr. Brennan said, everybody is vastly different. I haven't seen any two cases that are the same. And when sometimes prognoses are given, you know, numbers are given about how long you've got left to live, it's usually always wrong, okay? Sometimes it's just about the will of the person as well. And the power of the mind actually does phenomenal things. So you can plan ahead a little bit, and Dr. Brennan touched on this so remarkably well, that you can plan ahead, you can safeguard, you can get your ducks in a row, and you can say what you want to say before it's too late. I want to flip the coin. It's really morbid, right? But I want to flip the coin. Some people just never have that luxury. Some people can't say what they want to say. It's so sudden and it's gone. And it's just a moment in time that's lost. The concept of time is a daunting and confronting one, and most people do struggle with safeguarding themselves, but we do this every day. I read this amazing book, I'll show you this book, by Lee Sales. I don't know if you're a Lee Sales fan, I quite like her, but she wrote this book. It's called Any Ordinary Day, Blindsides, Resilience, and What Happens After the Worst Day in Your Life. And we've all had trying and troubling experiences in life, and you've been dealt a really significant one. But this book, she talks about, how do I confront my fear? So this gentleman's question about spirituality and how do I cope, and how do I cope with the grief, and how do I respond to those triggers? She talks and she explores all of that. And she talks about safeguarding. We are drawn to curious things. Dr. Brennan said it himself. Humans, you know, we're weird beings. We're drawn to catastrophic events. It sounds interesting. We watch the news. We hear about the Linz siege, and we hear about, you know, 9/11, and we're drawn to this. We don't really want to watch it. We don't want to know about it. We think it's horrific and it's devastating, but we're drawn to it. And the reason humans are drawn to this is to compartmentalize. Our brain needs to work out how on earth we safeguard ourselves so that we never find ourselves in that circumstance, in that situation. So the talks here today, which is a great event that you're here at, help you to piece parts of that puzzle together to help safeguard yourself so that a crisis doesn't happen. And all members of the multidisciplinary team will be helping you along the way to help safeguard you so that it helps you deal with the fears and the grief that you're experiencing. So we safeguard ourselves for the mere process of preparing for the future in case you need it one day. And that can be really morbid. And the speech pathologist will have lots of tricky conversations, lots of morbid conversations about who you are and what you stand for and what you represent and what your life is like and how you want to keep living it. Our job as a big team, multidisciplinary team, is to protect you from things that we know that can go wrong and result in negative consequences. We're here to help you safeguard everything from your voice to your swallow, and this means lots of discussions and informed choices to be made, sometimes with pressing time frames. An example of safeguarding, just to pop this into perspective, and you may have heard of this, is voice banking. It's a new thing, or writing a memoir, or just completing a family photo album. And usually the feedback that I receive from patients is that a weight is taken off their shoulders. They don't have to worry about that anymore because they've done it. Time is a card that you can always play, no matter what, but you need to play it at the right time. And your speech pathologist will nag you about this in terms of the things that we control, or that we help you control, which is your communication, your saliva and your swallow. Your speech pathologist, I say this to all my patients, will likely be really nice. You'll start off liking her, you know. We're really good at listening. We're really good at getting to know you. It's really the first question I ask people. I don't want to know about your MND as soon as you've walked in my door. I want to know who you are. Tell me a bit about yourself. Tell me about your work. And these people haven't answered that question for a very long time. So we're good at getting to know you. People start off liking us, and then we start becoming annoying, and we start to pester you really badly. And this relates back to time. The speech pathologist never works alone. We always work as part of a big team with the doctors and other allied health professionals. And we might see you in individual sessions or jointly with team members, such as the occupational therapist, the dietitian, social workers, pastoral counselling support, and collectively, we're your team of support. We're your hub of support. You can call us at any time. We are all poised, ready to strike to ward off symptoms that impact you negatively. You don't want them, we don't want them. The speech pathologist is skilled at assessing the following up there: your speech and voice, your communication overall, identifying any saliva and swallowing problems, and then we also, depending on the experience, of course, of your speech pathologist, we assist with legacy banking, which is quite new, better described as keepsaking. We'll talk about those things individually now. So staying in control of your speech, what does that look like? I just want to say that there's absolutely no guarantee that you will lose your speech or your voice. Everybody is very different. However, there is a high chance that your speech or voice will be affected in some capacity. The changes that can happen include things like reduced volume or reduced intelligibility due to slurred speech. It all depends on the type of MND that you have, and it's different for everybody, and the severity of these things is different for everybody. You may find that your speech or voice is better at different times of the day, depending on your overall energy levels, and you may find that your saliva can interfere with your ability to talk too. Speech pathologists are asking to see people earlier, usually when you're diagnosed, when you have none of these symptoms, because we want to let you know about some useful activities that you can engage in to help preserve your voice as well as maintain current muscle tone for a bit longer. So this is step one. So some voice banking, message banking or story banking, and low-intensity speech-voice exercises. So this is really the first step when your speech isn't really affected or it's started to become very, very mildly affected. And so voice banking, you may have heard of that, is just where you work through some computer software and you preserve your voice. So you record your voice and then you buy a computer synthesized voice that you might need to use later on. And you think of that as taking out, a patient's husband of mine actually just a couple of weeks ago said, so it's kind of like insurance. Yes, it is. You may never need to use it, but if you have the opportunity, you might want to look at doing something like that. Or message banking, where you can record things that are unique to you, things, frequent or functional things that you might need to say on a regular basis, and it comes out as your own voice with the same tone and melody that you usually speak in. Again, these two things are used in voice output devices should you need them later on. Some people like that because they feel it maintains their identity. If they've got kids, their kids can identify with their own voice easier than adapting to a new voice or the voice of a computer. And some people, I'd say there's about maybe 5% of my patients that I've seen don't like it at all. It makes them feel a bit upset. So it's a really individual thing, and we don't want you to put pressure on yourself about this. So I think if you've got the opportunity and you want to do it, you'll probably do it fairly soon. But if you keep putting it off, maybe it's just not the right thing for you. Or it's just finding the time to do it as well, because it can be a little bit time consuming. But it's very, very individual, and the speech pathologist will chat to you about that. But the key thing here is really about early intervention is best. So if you've not had any symptoms to your speech or your voice, chatting to a speech pathologist about voice banking, message banking, story banking is a good idea. To see if you want to do it, and you need to do it early. Again, it's about that time frame. We have pressing time frames because sometimes there's a bit of a cutoff and you can't do that type of stuff anymore. The low intensity speech voice exercises, there's some evidence that some exercises can help prolong the muscle tone around your face and neck for a bit longer. And the speech pathologist prescribes those, and we give you a set amount, and then we start drawing it a little bit back. These are quite handy when your speech does start to become affected and you think, I'm really not conversing anymore as much. I've gone about 3 hours and I haven't spoken to anybody, or I've just maybe said 1 or 2 words in that conversation, because you're starting to feel a little bit, what would be the word? You're just more hypervigilant about it. And so it's just supplementing the movements. Keep moving your mouth, but you don't want to overdo these things either. So again, it's about balance. And then we're always thinking, the speech pathologist is always thinking 1 step ahead of you as well, so about that safety net for you. So we'll also start having a look at making some adjustments to your speech when it is affected. And if you're experiencing some speech or voice fatigue at certain times of the day, you might want to supplement when your speech starts to be a little bit affected or a bit less intelligible in some situations, supplementing that with gesture, body language more so, writing, or starting to look at some apps that can help you get your message across too. So text-to-speech is where you type on a keyboard, you press a button and it speaks for you. And if you've done your voice or message banking, then it might come out as your voice, just depends what you want. And then you also have symbol-to-speech apps for those people who might be illiterate or have some very mild cognitive problems. Symbol-to-speech apps, same thing. You choose a series of pictures and it says a sentence for you. So they're the types of step 1 and 2. And then we will start chatting to you about the timing of more devices, things that will really need to start replacing your speech. So the first step is preserving your speech. The second step is about compensating or using alternate kind of supporting, I guess, more supporting. And then we move on to kind of alternative ways to get your message across. So these are more voice output devices, and looking very closely with the occupational therapist about how you're going to use that. Is it going to be typing? Is it that you're going to press a button with your knee or your head? Are you going to use a gyroscopic mouse on the arm of your glasses? There's always a way to get your message across. And sometimes the barrier to getting your message across is actually the fact that maybe it's training, there's some clinical barriers, maybe you're not getting access to training of these devices, but sometimes it's how open you are to accepting these devices. Sometimes good old-fashioned things like a laser pointer with a phrase board might be the best thing and the quickest thing. So we look at lots of parameters about your communication in terms of how fast and efficient it is. We want it to almost mimic how fast it would be when you actually talk. How accurate you're going to be, and how fatiguing any device is going to be for you. So we offer specialist assessment. And if you do have speech pathologists who are out in the community that see you at home, and then you go to an MND clinic such as where I work, we liaise together. So the speech pathologist and the occupational therapist from the hospital will work with the speech pathologist who sees you at home, and so on and so forth. So it's a huge team situation. The speech pathologist here is always thinking about longevity as well. It's important to mention. So we'll try and set you up with a communication system that meets your needs now and well into the future. Like Dr. Brennan said, it's not okay to be indicating yes and no, and that's it. We really want to know novel, specific things. You need to be able to tell us specific things. You might have done your advanced care plan, but then you decide, you know what, forget this, I want to change it. So it's good to have a way. We must always give you a way. The speech pathologist needs to always give you a way to have that to be heard and to make your choices known, as well as talking about random things. We don't want you to always talk about your diagnosis either. The diagnosis is part of your story, yes, and it's a very important one, and we want you to be able to have the right way to communicate what you need to ask and what you need from your health professionals, but we always want you to just be having conversations, happy things. You know, it's really good for your psychosocial, psycho-emotional well-being too. So if you're wanting to have a conversation with somebody, that's really, really important. A conversation about the grandkids or a conversation about planning a holiday. These are really important things, random things that you usually talk about. So we'll ask you lots of questions about that. Sometimes we also need a bit of a crystal ball. So the speech pathologist will ask you to delve into the future. And I just want you to think of that as like a bit of a Harry Potter moment, or like the best wizard or witch that you ever experienced as a kid, okay? Because it's really tricky, it's really morbid, and it's really emotional, and that's okay, because fear and grief and loss is a normal part of human emotion. So we'll chat to you about delving into the future. What might it look like, and what might you need to say, or what might you need to advocate for yourself later on as well. So we'll always be there to provide reassurance and a warm smile, and probably some hugs along the way too. So what does this all look like? So if we think about step 1 is not up there, but if you're compensating a little bit more in step 2, so the first one there, I'll use this little doobie, I'll try. This one here is more step 2. I'm going to write, and you might get a boogie board or e-writer. Has anybody seen these before? So this is just another way to write. It means you don't have to have copious amounts of booklets or pen and paper and things like that. It's nice and easy, it's portable, and you might like that. There's different sizes. So that's an example of writing. It's a boogie board. And then this is more what we call a mid-tech device. So this would be low-tech, and then this is mid-tech, and this is an iPad, somebody's iPad, borrowed from MND Association, I must say, which is great, with Proloquo Go app. So this is a symbol-to-speech app, and he's typed there, I like cowboy movies, and the speech pathologist will help customize this. This was for a fellow who was illiterate, and so he needed a lot of pictures to communicate. So that's just an example of that. And then here you have high tech. So this is an example of an eye gaze device. This is the eye gaze camera, and this would be mounted to your wheelchair or a table. And then this is an example of message banking up here, where they might have, how are you? How are the kids today? I need a cup of tea. Remember my sugar. I want to watch Selling Houses. Stuff that's unique to you, okay? It could be, I say to my kids, night, love you, see you in the morning. I'd have that as part of my message banking. So starting to think about, what do I usually need to communicate in my everyday life? And starting to take note of that. Well, that's something I say all the time. Or maybe it's your carer thinks, I love when he says that, and write it down, so that when the speech pathologist says, oh, what is it you need to write? That's the hardest bit. What is it that you need to say? And you think, oh, I've gone a blank. So start having a little bit of a log or diary of what you usually do or say if you can. So that's just some examples there. All right, and we move on to the saliva side of things now. So MND causes some saliva problems because there is weakness that happens around the mouth and the throat. So this ranges from too much saliva, which causes drooling from the front of the mouth, not enough saliva, which causes dry mouth, and then very thick saliva. And there's a bit of a continuum here. You can have a combination of all 3 of these, or you could just have one of these. And there are treatment options for each. And while they may help, they will not necessarily restore you back to your normal equilibrium that you normally experience in your mouth. And so what the treatment kind of options start to become about is what's bothering you the most. Is it the runniness, or is it the thickness? And sometimes we have to get the balance. We have to play with the balance. We'll try you on one medication perhaps first with the medical team, and we'll see what that does. What's the effect of that? And then we'll start fiddling to get the balance right and where it's comfortable for you. So we try and restore the balance there. Lots of environmental measures also help to combat too, and it's good to keep a diary of any changes you're experiencing with regards to saliva, so we can work out, oh, it might have just been the aircon, you don't need any medicine. Some dust and allergens, change of seasons as well. Usually we always see a little bit of a change to saliva with the change of the seasons. Foods or drinks that you might have had might cause a problem, so if you're deciding, I just only want to have my tea and I hate water because water is a little bit tricky for me now, you might find that you just are really dry because you're having 6 cups of tea a day, okay? So it might just be little things that we have to fiddle with, and also your posture plays a role in terms of saliva as well. In severe circumstances, it might cause you to feel embarrassed. You might withdraw from going out with others, or going out to eat and drink, going to cafes, that kind of thing, or talking to others. So it's important, the speech pathologist will ask you about that, but chat to the speech pathologist about that too. The speech pathologist will usually take measures of your saliva every time she sees you, just to ensure the balance is a good one, and implement strategies in a timely manner. Sometimes saliva might cause you to cough. So managing your saliva is always done with the medical teams, just so that we make sure that your chest is nice and safe and free from chest infections. This gives you a little bit of a breakdown again, just an overview. So sialuria, you might hear the clinician use this term, is the thin, runny saliva. And then you have the thick saliva, which can be a little bit gluey or phlegm in your throat. And then xerostomia is the dry mouth. But there are treatments, we just have to fiddle with them to get it right. And there's some research going on in that area to find better treatments. Particularly, we're good at treating the thin ones, I think, Dr. Brennan, aren't we? But the thick ones, they puzzle us a little bit. So we have to fiddle with a fair few things there to get that a bit right and get you comfy again. So saliva control, like I said, can be managed by posture, your environment, natural remedies. Things like if you're feeling a bit dry, pineapple juice is good, papaya is good. It has a protein in it or an enzyme, and that can stimulate a little bit more saliva. There's lots of different things on the market, mouth moisturizing gels and sprays that can help short-term relief of dry mouth, that kind of thing. Peppermint oils, another one. You know, here in doTERRA, has anyone heard of doTERRA oils? Like, it's a big craze right now. So, you know, looking into natural remedies like that. And then we might need to look at more prescription medications. That's where the medical team comes in. And then in some situations, saliva might be so much so that you just need help with some things like oral suction machines to help vacuum up. It's like a little vacuum. It vacuums up some annoying saliva, or cough assist machines, which help you get a strong cough. It simulates a cough to help bring that phlegm up. While most people are suitable for these types of things, it depends on your medical history and the type of MND that you have. So those with no bulbar symptoms tend to do well with something like a cough assist machine, but those with the bulbar symptoms, where it's your speech and your swallow that's been first affected, it might not be so great. But the thing is that we can open doors so that you can have a trial of these things and see what works for you. There are other invasive medications I should mention about managing your saliva, things like Botox and so on, but that just gets discussed with the medical team, and there is a bit of a hierarchy that we work through. So we start with gentle things, and then we have a look at more other options if we need them. Okay, and this one brings me to mouth care. So it's never been a better time to brush your teeth morning and night. I'm serious. There's going to be a bit of a war going on, and you need to promote some world peace in your mouth. So it's a battle of the good versus bad bacteria. So a clean mouth means less bugs and a safer chest. So mouth care, when we're sick, and actually I was thinking about this on the way here. Mouth care is really undervalued, but you know, kids actually also really undervalue mouth care. I remember my sister having a day off brushing her teeth on a Saturday because she was just so fed up of brushing her teeth. But it's such a ritual every day, but when we get sick, we just don't prioritize it at all. We leave it aside. So there are many reasons for this, why mouth care might be challenging and why you might not prioritize it, and that might be sink access isn't as easy anymore, or doing this independently is getting a bit tricky, so I'm going to have to ask for some help, or I'm good at the front of my mouth, but I don't want to ask for help at the back of my mouth. It feels a bit burdensome. It might feel a little bit impolite to ask someone to clean your mouth for you. Humans are so finicky about mouths. The nurse and the speech pathologist and the doctor, we do not get grossed out by your mouth. In fact, I find it fascinating. So when you ask me to clean your mouth, it's like the best day at work for me, okay? I love it. I feel like I've done a mini surgery, you know, I love it. And there's something about a clean mouth. It just makes you feel refreshed, rejuvenated. It better equips your taste sensation, and it helps you with your talking. But the biggest and important job that a clean mouth really does for you is protecting your chest. So, as you know, we're going to talk about this in a second, about your swallow. As your swallow becomes affected, or if you have a lot of runny or thick saliva, that might make you cough, yeah? You might cough on your saliva, you might cough on your drinks. It's the bugs from your mouth. The fluid usually is reabsorbed, but it's the bugs from your mouth, correct me if I'm wrong, Dr. Brennan here, but it's the bugs from your mouth that would go the wrong way, that actually fester and cause the bacterial infection, causing you to have a chest infection, or in a worst case scenario, a pneumonia. So the speech pathologist is extremely risk averse, okay? Extremely risk averse. I mean, I didn't want to even get on a plane last week. I had to go on a plane. I was so fearful of going on the plane. We're just really risk averse people. So we want to prevent things. Prevention is our primary aim. So elimination of the bad bugs means that if you were to cough on your saliva or your food or fluid, rest assured it's got to be okay, and you'll ward off those bugs. The other thing is about your mouth care is that we are all so different with this. How I clean my mouth, how I clean my teeth in the morning or the night is vastly different perhaps to how you do it. You may prefer to do that in the shower, you may prefer just a bowl, or you may have had the sink all the time. It might be the kitchen sink, not the bathroom sink. And we all have these odd little quirks that we have that make us individuals, yeah? So what I want you to do, your homework really after today from a speech pathology point of view, is to go home and write your routine down. If, and remember it's about safeguarding, if you had to ask somebody to clean your mouth, how would you like that done? I'll give you a really nice example of this, okay? So in my house, my job is to do the washing, okay? I don't want my husband touching the washing because he doesn't put enough soap powder in, okay? And so then when he does the washing, it's just not right. I have to wash it again, okay? And so it's the same thing. The way I perceive that my husband might clean my mouth would be very different to how I actually want it to be cleaned. So your homework is to go and write down your own routine of how you clean your mouth. And it's really important because one day that might be the thing that you really, really need from somebody. And you're hoping and wishing that Claire comes walking through that door, but she's off today. She only works 3 days a week. How dare she, you know? So write it down. And equally so, back to communication. You know, we kind of, humans, we think it's a little bit Hollywood. We see all these Hollywood movies and we think, yes, and it's, you know, kind of the end of life and I'll say I love you and all the beautiful things I want to say. I have this poster in my room that I made that says, you know what, guys, say it now. Let's just say it now. So even me as a person, I will say whatever I want to say to my family before I leave that day, because you just never know what's going to happen or what's around the corner, right? So there is no right time to say what you want to say to family members. And I think that's the hard thing, perhaps maybe from a carer, and correct me if I'm wrong here, you're yearning to say what you want to say. You feel like you're bobbing around the person. It's like that poem. He wasn't quite sure how to navigate the situation and what to say, and am I doing the right things, and is that really what she needs from me right now? Just say it now. Just let it out, and you'll feel 100 times better So loosey-goosey all the way, just say it. Whatever's on your mind. If it's good things, great. If it's not so great things, just say it. For example, about the trigger, you know, when somebody says something you think, oh no, I can't go there again. Let people know that, oh, I just find it really hard when you say those things, you know? Or the first thing someone might say to you when they come in the door is all about your MND, or you feel like they're only looking at you through this bubble that's MND and not the real you, not the you that was before. And so it's really talking to people about having those conversations about things you like again. That, oh, yeah, but never mind about that, you know. And allow yourself, maybe in terms of this coping with grief and loss, allow yourself an hour, perhaps, or 2 hours, just to think about your MND and what's happening to you and the horrid nature of it and all your fears that go with it. Allow yourself an hour and then step out of that hour and live again. And then you'll find that you'll be dreading that hour. You'll be dreading that hour where you have to think about your MND, and slowly that hour will dissipate, and perhaps there'll be no hour at all, and you'll be a much stronger, be able to maybe be a bit stronger in terms of how you can cope with this whole fiasco that MND is. So maybe see if that works for you as well. All right, moving along, because I told you I run a bit late. So we're going to talk about the swallow now. So we're all of the same design here. We all have the same anatomy. It makes for some really bad engineering. We have 2 tubes here. They are side by side. It's really not ideal. So we're looking here at the lips, the teeth. The tongue is this big, massive muscle, and that's what's going to let you down a little bit, this big muscle that is the tongue, okay? There's a little pocket at the end of the tongue, and food will fall into there. It's normal, it's fine. And then there's the latch door called the epiglottis, and that closes the airway when you swallow. Okay, and then you've got 2 layers of vocal folds. One is called the false vocal folds, and they close. And then you have your true vocal folds, which sit underneath, and they also close. They're about here, so they help you talk. And that's your entrance to the airway that helps you breathe. And when you swallow, we obviously stop breathing for a very, very, very tiny second. And then we swallow it down into the food pipe. Well, this is the throat here, and then the food pipe goes here. Now, the swallow and all the way to the stomach, actually all throughout the body really, correct me again, Dr. Brennan, is really a series of valves and pumps, and it works on pressure. One door opens, another one closes. One door opens, another one closes. So anything that's going wrong in your mouth, maybe it's a little bit of weakness here in your tongue, maybe it's a little bit of weakness here. This is the passage to the nose. And this little bit here, you know, it's called a soft palate. It's the dangly bit at the back of your mouth. And the speech pathologist will always look at that. She might test your gag and everything. And we want to see if it elevates. We want to see if it lifts up and touches this wall to close the nasal passage, okay? If it doesn't close, you usually get regurgitation up through your nose. It's really rare in MND. I don't think I've seen it. But this little bit of tissue, if there's some weakness, can cause some distortion to specific sounds and things like that. But also, if it's not coming into nice hard contact with this wall, it's going to impair the pressure. So it's just a series of doors that open and close. Obviously, we want you to control your food and drink in your mouth, and then it travels into your throat. You've kind of got curtains at the back of your mouth, or pillars. They're called facial pillars, but they're like curtains. And it's like brushing, the food brushes past the curtain, and it does a little bit of a wave, and then you swallow your food and drink down. And that triggers the swallow. So most people's swallows are triggered at those big pillars up here. And some people, if you've had a really big cheeseburger, or you know, you're really enjoying your food and you're taking bite per bite, like really fast eating, your food will fall here, and that's okay. And there's lots of new evidence about the swallow that there's new normals. So even though your swallow might be a little bit delayed, it could be normal for you. Okay, a lady came to my office once and she said, it's so bad, I'm doing 2 swallows per mouthful, and I had an x-ray of my swallow and they said that was abnormal. And I said, no, that's okay. I do 2 swallows per mouthful sometimes. So your second swallow might just be clearing. So it's okay. And as long as you're compensating and you're swallowing safely, that's the main thing, right? And you're really good. Humans are really good at compensating for anything that goes wrong in the mouth and the throat. And the speech pathologist is going to try and keep you on your normal food and your normal drinks for as long as we possibly can. Our aim is not to immediately change you to something that's not very nice and disgusting. We really want to keep you on your normal food and normal fluids, and that might be just applying some strategies where we maximize your airway protection. So we obviously want our food to travel down to the food pipe and off into the stomach. We do not want it to enter the airway, okay? So that's when you might go, oh, something snuck in there, and you might throat clear or cough, okay? Excessive throat clearing is a concern. If you have your cup of tea at lunch and you just go, that's okay, all right? But you'll know a throat clear that means, oh heavens, something just really snuck in the wrong way, all right? And the thing about the swallow is that people with MND, their sensation is usually intact. Unless you have other medical health problems, then your swallow might be impaired or your sensation might be impaired for a slightly different reason. But the sensation is usually intact. So you will feel things go the wrong way, and some people don't mind it and some people find it uncomfortable, okay? And there will come a time where you might decide, you know what, I'm sick of this. Maybe I will listen to that speech pathologist and decide maybe it's time. So remember, it's all about balance and all about time and accepting that, oh, I might just need to make a few changes. I might just need to adjust my life a little bit just so I can live a bit more comfortably. And that's the whole aim here, is helping you to swallow safely, keeping you comfortable and keeping you free from chest infections. Obviously, if stuff is entering your airway all the time, that puts you at big, massive risk of getting a chest infection or a pneumonia. Okay, so the speechy is preventing that from happening. We don't want that to happen. And there are different ways, like the strategies I mentioned, there's techniques that we can use that are non-invasive that you can apply. And we might also make changes to the textures of your food and change the thickness of your drinks, for example. But we try to do that a little bit later on. There's no swallow exercises that I can give you. Like your speech, remember I said there's a low intensity exercise program I can sort of give you. There's no program that I can give you, no exercises that I can give you to help with the muscles of your throat. The best thing is just keep talking, that I know of. Keep talking and keep eating and drinking carefully and using the muscles. There is some research going on in that area about electrical stimulation, and they did try some, kind of hardcore. They're not sub-maximal, like they're quite intense. They're exercises that we would use for someone post-stroke, for example. They're just too much, like the balance with them isn't right. So they actually would fatigue your swallow muscles rather than helping them to get stronger, okay? You might also think, oh, this cup, every time I drink out of this deep mug, it's going the wrong way. But when I drink from this particular cup, or if I drink from this spouted cup, I actually do quite well. So you might decide that it's all about acceptance, right, of your MND and accepting that you can use some aids. So if you can use a cup to help you swallow your normal drinks safer, then go with that. All right, alongside the dietitian, we might also talk about this topic here, peg feeding, the tube feeding. And we talk about that when we start to become concerned about weight loss, loss of appetite, dehydration, constipation, and the swallow obviously getting weaker. And one never imagines needing to have a tube to have nutrition and hydration, and that can be ever so daunting, and we know that. But it comes back to safety and safeguarding. If your swallow becomes worse, what happens then? This all depends on your own decisions that you have about prolonging life, ensuring comfort, and perhaps the tube feeding might lessen trauma. Who knows? It's different for everybody. And certainly talk about the people behind you. There was a PEG study that was done about people's decision making, but the results aren't released yet, so we'll keep you informed of that. But it's good to have the conversation about a PEG and make an informed decision either way. So that's the swallow. And we're nearly done. We talk about legacy banking. Speechy gets involved with this because it's very communication based. So we do legacy banking more and more now. I think social work historically started it. And then the speech pathologist shares the role because of the communication type stuff. You might need to type or write, or you want to speak, you want to record yourself. And we do, why would we do legacy banking? It's because your life is valued, and it's about humans' quest for survival. You know, this is a great way for you to survive. And I think everybody should do this type of thing. We kind of do this anyway. On Facebook, we're sharing moments in time of our life, you know, and we don't want you to go. So sometimes this may not necessarily be on your agenda in your top 3 priorities, but it might be something that your spouse or your carers or your families really need from you. But again, we don't want you to put pressure on yourself, and you'll know what's right for you. And it's a very individual thing, but just letting you know that there are people out there in your hubs of support thinking about these things, and they'll chat to you about this when this becomes relevant. So simple things like you go into a bookshop and someone's wrote an autobiography or a memoir, exactly the same thing. It could be you just write a page. It could be like that gentleman that wrote the poem. What a great legacy of that horrific journey, yet he's captured that so beautifully that it's almost quite romantic. And you can really see how he feels about his wife. So do a memoirs if you think. You can do it by proxy if you can't type. Maybe someone else can for you. Letters to family. I have this patient right now, she's recorded. She can't write because of upper limb weakness. She's recorded some letters to her family. Cards. So if you're a mum or a dad, a young dad, and you want to, you know that movie, P.S. I Love You? You know that movie? It's really sad. I can't watch it anymore. And he delivers flowers. I mean, it's really Hollywood. There's flowers delivered every Valentine's Day or her birthday or whatever it might be. But if you're a young parent, perhaps maybe it's buying a stack of $1 cards. And I had a patient do this. She had 2 young children, and she wrote birthday cards for every year until they were 21. It's things like that. They're horrible. Think of all the anguish and all the emotions of that day. But we're here to help you with those types of things, even if it's coming with you to help you buy the cards, even if it's sitting next to you and holding your hand, or taking you out for a coffee and having a chat about it. There are other different things depending on how tech savvy you are. You might want to use the Record Me Now .org, that's up there, that's this one here, where you can record yourself. And it's not about, here's my words of wisdom, it's about jokes, it's about whatever, it's about capturing you as you are, and that's how you'll always be remembered. So it's just about, it's a bit sentimental, but I like this sort of stuff because I'm a mushy romantic, but you know, see, it's not for everyone, but see what you think, and you might have said enough. So I think I'm just going to finish now on some quotes from my lovely patients about how they live well with their MND. And so I asked some people, I was quite brave enough to ask some people about, hang on a minute, how well do you live with this? Because I can stand here as a clinician of 13 years and say how I think you should live well with MND, but I think there's such power in hearing it from people who are going through the same or similar things as you. Now in the black there's a little illustration of all the things that I've talked about beforehand. So this is their speech pathology management to date, who they are in terms of a speech pathology kind of, you know, their speech pathology profile, I guess. But what I really want you to think about is what that's meant to illustrate is that they're still living. So this one person says, I live well with MND by not thinking about it. I keep myself busy and do the things I love, like baking and cooking for others. Now that not thinking about it, it could cause some alarm bells. We may be spending that hour, but she's not letting it dictate her life. She's getting on with things. She can't eat, but she still cooks for others because she likes it. I live well with MND because I'm surrounded by family. I also keep doing the things I enjoy, like trips down the south coast, watching the footy and letting my dog inside, which was a big no-no before. I stopped asking questions about prognosis because what would it achieve? I live well with MND by thinking of things that make me happy, like Sri Lanka, flying, my family, my friends. I am very happy. I don't get scared because I think of happy things. The support of my family and my faith helped me to live well with MND. I don't like that I have MND, but it really makes me upset when I see young people with MND, because I have lived a beautiful life and seen my kids grow up and been lucky to see my grandkids grow, and that's all I ever wanted. I also practice with things I might need in the future, like my eye gaze device. My family always make me laugh. They help me no matter what. I try to look at the bright side. I make the most of the time I have left. I wrote a list of everything I want to do. Life is too short to spend it worrying. I go on holidays with my family and it relaxes me. I had to retire from work, so traveling was what we were going to do when I retired. So we go on road trips interstate and I fly overseas. It's been good for me. I have made even more memories with my family than if I stayed at home. Still living. And this one is a profound one, and this lady, she's phenomenal. She's here today. And she wrote a whole page to me that I've kept and safeguarded just for her. And she wrote, "After being diagnosed just before Christmas, many changes have occurred in my life. Knowing that my health will deteriorate, I have started to do things now, not tomorrow. I have travelled to China," oops, spelling mistake by me, "Canada, and now planning to see more of Australia. Learning to slow down has been the hardest thing to do, accepting that I have to stop and rest and then up again for the next day. I still enjoy gardening and walking and being outside, just at a slower pace." And that's it.